12 most common types of headaches, their causes, and different ways to treat them. Headaches are pretty common, and almost all of us suffered from them at some point. But do you know they are not all the same? According to the International Headache Society, there are around 150 types of headaches, all with different causes and treatments. Maybe the reason your headache is not going away is because of incorrect handling. With little awareness, you could recognize the cause and cure your headache in the right way. In today's video, we will share with you the 12 most common types of headaches, their causes, and different ways to treat them. Number 1. Sinus headaches. This kind of headache is very prevalent and occurs due to a blocked nasal cavity and inflammation of the sinuses. It comes with pounding pain around the cheeks, ears, and eyes. You may feel uncomfortable while making any movements. If the pain gets extreme, it can reach your jaws and teeth too. To make the symptoms disappear, you can use over-the-counter painkillers and saline nasal spray to unblock your nasal cavity. If the headache stays for long or gets unbearable, consult an ENT specialist. Do you find this video interesting so far? Please don't forget to subscribe to my channel. Hit the like button and ring the notification bell if you want to see more content like this. Number 2. Headaches due to head injury. A head injury is often followed by a normal to severe headache. With headache, you could also experience nausea, confusion, or unconsciousness, pain in the eyes and the ears. The most important thing to do is consult a doctor as soon as possible after a head injury. If it is nothing serious, then the doctor would prescribe OTC medicine and rest. Number 3. Migraine. It is one of the most common types of headache. In migraine, you feel pounding or throbbing pain on any side of your forehead. Sometimes vomiting is the only way to subside this kind of headache. They usually occur due to high brightness, extreme temperature, lack of sleep, high-pitched sounds, dehydration, hunger, stress, or strong smell. Most individuals with migraines see flickering or floating spots of light. Taking rest, managing stress, drinking fluids, or placing a cold cloth on the head could lower the pain. Number 4. Stress headaches. This type of headache is commonly known as a tension headache. It involves the contraction of the scalp and neck muscles, and an individual feels tightness in the head and neck areas. As the name suggests, the cause of this type of headache is stress, depression, anxiety, or sometimes head injury, which causes tension in the head and neck muscles. Tension headaches can also occur due to excessive smoking, dehydration, and poor posture. Hydrating yourself, improving your sleep cycle, and painkillers may help ease the pain. Your doctor might prescribe medicines such as ketorolac, naproxen, and opiates. The symptoms of tension headaches are very similar to those headaches that occur due to brain tumors. Therefore, consulting a healthcare provider is extremely important to detect the severity of the situation. Number 5. Hypnic headache. This type of headache is also known as an alarm clock headache because it occurs at night and wakes up the person. The hypnic headache is more common in people who are 50 years of age or above. The pain in hypnic headaches occurs in both sides of the head and ranges from mild to severe. According to American Migraine Foundation, taking caffeine before bed, either in the form of coffee or a pill, and anti-inflammatory drugs like indomethacin could help treat the hypnic headache. Number 6. Cluster headache. These types of headaches happen in clusters. They appear for a short time with high severity, go away on their own, and then come back again. They are recurrent and remain for weeks or a whole month. The fascinating thing about cluster headaches is that you will get them in the same season every year. The pain in cluster headaches usually starts from behind one of the eyes and then spreads to the neck and ears. Excessive tearing and restlessness are symptoms of cluster headache. Deep breathing exercises and medications like lithium, melatonin, sumatriptan, or verapamil could help. Number 7. Headaches related to caffeine. The excessive intake of caffeine makes the blood vessels surrounding the brain narrow. This causes pressure on the surrounding nerves and increases the blood flow. When you cut down the caffeine, your blood vessels widen up, and this results in throbbing pain in your head. Moreover, the pain-modulating receptors in brains can also get blocked by using caffeine, thus decreasing the spread of the headache. The only way to prevent this headache is by limiting the intake of caffeine. However, if you already have got a headache, OTC drugs might help relieve the pain. Number 8. Hormone headache. Hormone headaches are also known as menstrual migraines. Women may feel this type of headache every month, during or even before their menstrual periods start. The menstrual headache is often associated with sensitivity to light, throbbing pain in the head, dizziness, fatigue, and nausea. However, hormonal headaches in women are not only due to menstrual periods. They can occur due to other hormonal changes like lactation, pregnancy, and menstrual pause as well. Relaxation exercises, yoga, NSAID, or triptan could help in controlling the pain. If the cause is a menstrual pause, then hormonal therapy is recommended. Number 9. Exertional headache. Headaches that are associated with any physical activity are also called exertional headaches. For example, during exercises like weightlifting, you exert your body. As a result, the muscles of various parts like the head and the neck require more blood circulation. This results in the dilation of the blood vessels, followed by a headache. Exertion headaches are not long-lasting. Over-the-counter medicines may help get rid of the pain. Propranolol beta blockers, or drugs like indomethacin, are usually prescribed by the health specialist. Number 10. Hangover headache. Excessive alcohol consumption can result in throbbing pain in the head. This type of headache is known as a hangover headache. These headaches get worse with movements, and they occur on both sides of the head. Their symptoms are very similar to those of migraine. Alcohol decreases the production of vasopressin hormone. As a result, the body becomes dehydrated, which causes a hangover headache. Due to alcohol consumption, kidney functions are affected, and toxic products are not excreted sufficiently from the body. According to some health experts, the excretion of these products from the body is the only way to get rid of a hangover headache. OTC drugs like ibuprofen or aspirin help in lowering the severity of the headache. Number 11. Rebound headache. This type of headache occurs due to the overuse of medicines. These headaches are persistent and are very similar to tension-type headaches. Moreover, they are more painful in the morning as compared to the rest of the day. It can be due to the overuse of medicines like aspirin, ibuprofen, acetaminophen, sedatives, migraine medicines, and drugs used in sinusitis. Quitting the overuse or taking them in small doses can help. Detoxification might help to ease the rebound headache. Number 12. Hypertension headache. As the name suggests, hypertension headaches are caused by hypertension that occurs due to high blood pressure. You should not ignore them or take them lightly, because it occurs when the blood pressure is extremely high and requires immediate medical attention. Any movement or activity makes this headache worse. It is often associated with bleeding of the nose, pain in the chest, and shortness of breath. The headaches go away when the blood pressure gets under control. The types of headaches vary significantly based on their intensity, causes, frequency, and location. After the correct diagnosis, it becomes easier for the healthcare provider to prescribe a suitable treatment. Whatever type of headache you are suffering from, you should never ignore it, especially if it persists for a long duration and severity is not decreasing at any cost. Such headaches could be a warning signal of other issues like brain tumors or meningitis. Did you find this video helpful or informative? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!